Hello and welcome to another episode of PodiatryWeekly.com. My name is Dr. Kazak. I'm a podiatrist in Northern California. On this episode, I'd like to speak with you about why patients spend such a long time in the lobby of the doctor's office. I was able to come up with at least 8 reasons why you may be stuck waiting to see your doctor, even though you yourself arrived on time. It's a very, very common problem. I've been there myself. So waiting in a doctor's office can be a very frustrating experience, of course, for many patients. And there are a number of reasons why it may take a long time for the patient to actually see the doctor. I've discovered that there's at least 8 different reasons. So let's talk about those reasons. One reason could be because your doctor is just being human. Doctors deal with mundane everyday problems. They get sick, have kids that don't want to get out of bed in the morning, and they have responsibilities outside of our jobs, like buying groceries, taking out garbage, the regular stuff that we all do. And so that could, of course, delay the doctor from coming to clinic. People get into arguments with their spouses, they have sleepless nights, flat tires, and so forth. So before assuming that your doctor is sitting in the back of the office and just checking his or her email and or scrolling through the latest updates on Facebook or Instagram or another social media platform, please give your doctor some benefit of the doubt, especially if you are the first patient of the day and there is seemingly no other reason why your doctor is late. I always appreciate my patients asking me if I'm doing well when they see me, especially if I'm seeing them a little later than their scheduled appointment time. This actually shows me that they appreciate my humanity and they trust me not to be abusive and respectable of their time. I know that most of them had to rearrange their day to see me. Some actually had to pay people to watch their kids. Some have taken time off work, and most are experiencing at least some, if not significant, discomfort or pain as they're waiting for me. So both patients and doctors are humans, and we're doing our best to live out our life with purpose and significance. So starting with this understanding allows all of us to establish a good doctor-patient relationship and then continue building on that relationship. In some medical specialties that deal with chronic conditions, this relationship can continue for decades until literally death breaks that relationship, because you will continue seeing the same doctor over and over. Patients that came ahead of you and is having a medical emergency, it was running late, could be another reason. In general, doctors divide their schedule into seeing new patients and follow-up patients. So reasonably, new patients are allocated more time to allow for gathering of all the facts and comprehensive assessment of health and illness. Frequently, patients present with long list of illnesses, especially if it's the first time seeing patients. Many illnesses are chronic and require the doctor to take longer than expected to ensure comprehensive and complete evaluation so as to come up with the best long-term care plan. That takes time, unfortunately, and sometimes such an evaluation takes longer than expected. This requires the doctor to run over the time that he or she thought would be required for that particular patient encounter. Seeing patients with complex lower limb wounds, for example, is very common in my practice. These wounds can become very painful, which requires me to slow down, to be careful, and to be as careful and gentle as possible, removing bandages that are stuck potentially to draining sores. And if the wounds are infected, then of course there needs to be a surgical cleanup sometimes to address the infection. Antibiotics need to be ordered. This sometimes these procedures require numbing and injections. Large leg wounds require application of multi-layered compression dressings, which frequently take a significant amount of time. And frequently people have pain and issues on both lower limbs, so that is time consuming as well. And that cannot always be predicted. So the best I can hope for, of course, is for you as a patient to appreciate that I'm working on helping another human being, a patient who is complex and requires significant help. The only solution in this case is to, for the doctor maybe to allocate a longer block for such patients at their next visit, but that requires, advanced planning. Number three reason is overbooking. So doctor being forced to see multiple patients at the same time. That's what overbooking means. Frequently, doctors are forced to schedule multiple patients for the same time slot. This happens in cases of urgent need to see a patient soon after an initial appointment. And this could be because the patient had a recent surgery and now needs a follow-up very quickly after, or dealing with a complication. This could be because a new urgent problem arose and the doctor must evaluate the patient to avoid worsening of the symptoms or complication. These appointments are called double or overbooks and require significant attention to detail and efficiency. Another reason, reason number four, doctor is working with a trainee, right? So in our previous video, we talked about trainees. Medicine is a profession that requires continuous training and skill perfection. As technology advances and older generations of doctors retire, new physicians must take their place, but they must be trained. Without these new physicians, the medical system cannot be sustained. So to allow for this, doctors in training must be involved in the care of their patients. They must witness and practice and participate in the process with direct patient involvement. They must see and learn to deal with wide spectrum of human illness, from something very basic, in my profession, trimming a callus or nails, to wound care and surgical interventions. They must learn how to be lifesavers, life extenders, life preservers, and sometimes offer comfort care to the patient. One cannot learn medicine from books and videos alone, although that would be amazing, not possible. So your doctor may have trainee learning from them and must take longer to educate, to answer questions, to guide, to clarify, so that you and your kids will have quality doctors to turn to in their search for healing. And you become an educator yourself in this case as a patient. Number five is doctor works through lunch and is trying to hydrate and eat. Most doctors rarely get a regular break for lunch. Honestly, sometimes it's even difficult to take a bathroom break in the middle of the busy clinical day, especially if items 1 through 4 described above are happening at the same time. So frequently I work into lunch hour and even through lunch, feeling dehydrated, mildly overcaffeinated, and hungry. I do my best to serve the needs of my patients. Unlike a car mechanic, I cannot just leave the patient and disappear for a couple of hours just to come back later. I need to continue working to serve my patients. So I value the time of my patients and understand that they need to be helped, but sometimes I have to take a break too. Number six is doctors are just late because they're slow. I mean, that could be happening too, right? So doctors can, of course, be slow for various reasons. We get tired, depressed, or burdened with administrative tasks created by administrators and insurance companies. We're delayed on the phone with those individuals. We get overworked. And of course, with that, our efficiency declines. Sometimes we overcommit and underperform, but many times we simply force ourselves to slow down to ensure that no mistakes are made, as we care for human beings with real lives which can be permanently changed by our actions, good and bad. So we must be very careful, and sometimes that requires slowing down. Number seven is limited staff at the office results in slow healthcare delivery. So when our support staff is running late or calling sick, I have to face the dilemma of either canceling patients or seeing patients at a slower pace, because patients usually wait many months to be seen. Most doctors' offices will persevere and work overtime and even through lunch to make sure that everybody gets proper care and medical attention. However, Delays are inevitable, and a good front desk staff should be alerting the patients in the lobby as to the reason the healthcare delivery is slow. Communication is key, very important. This gives the patients knowledge and freedom to wait or reschedule. It's important to work together. And reason number eight, finally, is excessive paperwork and outdated technology. Some doctors' offices require patients to fill out extensive paperwork, which can take a long time. And this can add, of course, to the overall wait time for patients. This is especially true if you're a new patient and must register with the office. Some offices try to shorten registration process by asking patients to pre-fill information and submit it over the internet or fax or through a secure portal prior to coming in. On the other hand, doctors are frequently delayed by the need to complete the paperwork for patients prior to helping the next patient in line. This paperwork may include notes to excuse patients from school or work, filling out disability documents, DMV documents, orders that must be placed for supplies, prescriptions, referrals, and many other reasons. All this paperwork really slows things down and sometimes is unexpected. Outdated technology, of course, plays a major role in the slowdown. Some doctors' offices still rely on paper based systems, which can slow down the process of checking in patients and also scheduling appointments. So, what can be done about that? Well, in order to minimize waiting times, I believe patients can try to schedule appointments during non peak hours, such as early in the morning or late in the afternoon, if that works for you. Patients can also try to schedule appointments with doctors who have a reputation for being efficient and on time. I mean, read online reviews, that could be very helpful sometimes. Additionally, patients can try to complete any necessary paperwork before their appointment time and arrive on time for their appointment to avoid delays. In conclusion, waiting in doctor's office can be a very frustrating experience for many patients. There are a number of reasons why it may take a long time for patients to wait in doctors' waiting rooms, including overbooking, emergencies, limited staff, complex cases, paperwork, outdated technology, limited resources, time consuming tests and insurance issues, and of course, patients' delays. However, patients can take steps to minimize their wait times by scheduling appointments during non peak hours, scheduling appointments with efficient providers, doctors, surgeons, completing necessary paperwork before their appointment, and also arriving on time for their appointment. All of those could be extremely helpful. Doctors, on the other hand, have a role to play as well here, and we should work hard to improve our time efficiency, office staffing, and must communicate clearly with the patient when waiting times are becoming unpredictable. If you enjoyed this episode, please click the like button, subscribe button, share this episode with your friends and family. I hope to see you back. I hope you enjoy our episodes here, and of course, visit us at podiatryweekly.com. Until next time, take care.